I'm Mahamoud Merali. I'm the consultant psychologist, clinical and counseling at the Aga Khan University and department head. I'm also the associate professor for Salinas University in Italy. When you talk about the mind, I think Sigmund Freud tried very hard to study it, and we're still in the unknown. The mind tends to play tricks at this time, and it can go very far in how it sort of portrays things, imagines things. And so we are getting more and more people who are now displaying anxiety kind of symptoms because of the unknown and the fears that are sitting there. And so that then leads to a behavior approach that now tries to counter what they are feeling. And that behavior then leads to them doing things that normally they would not do, whether it's shopping, whether it's fumigating the house, and whilst those are good things, at this time it can be a bit extreme. And I think there's going to be two areas that will come up. One is the lack of touch at the moment, which even though is important, but because of the situation, people have become wary of it. And so to some extent, there is this adaptation process, almost like an evolution kind of thing, where people have pulled away. When we met today, we didn't shake hands. Usually we would have, and had a chat or two. But the moment you pull away, automatically there is a wall that's got created, whereby even the usual chat that we do didn't happen. And so that's one aspect. The second is going forward. Is that going to change people? Are they going to now start pulling away as it becomes a default? And it becomes second nature now not to shake hands and instead give a fist, don't hug. And so there is that possibility that some social component of our interaction may have an effect, and maybe not in the best way, because we'll pull away, and maybe if we look at it positively, reduces chances of infection for other things as well. For a long time, mental health has been almost a forgotten, hidden, or even a taboo subject. I think the time is overdue for us to address mental health as a standalone issue, with the importance and significance that it has on its own. At the moment, mental health is more or less combined a little bit with other health issues. And it's taken as a disease like any other disease and dealt with, and sometimes not talked about. I think there is opportunity here for mental health to come to the forefront and become an issue that we now tackle head on, because it's been there, it's going to be there, and it's going to grow for sure. And it's going to grow across the age groups, because this incident is the first time ever that a pandemic has put a stop completely to interaction, to religion, practice of religion in different forms, congregational spirituality. And so that is going to hit people really hard. Do you go back to church feeling comfortable, or mosque feeling comfortable, or do you go in with a caution? Or do you continue practicing how you've learned to practice? So there is going to be a shift, and mental health will become more and more significant as we go along, because there are two components of mental health that affect people. One is for how it affects people around you, even if you don't have a mental health issue. And the second one, and so how you will relate to them, because those who are anxious are going to get more anxious. Those who have a predisposition to anxiety or depression may fall into now the category of depression or anxiety. And then there are those who already have existing mental health issues, challenges, anxiety, depression, other mental disorders, etc. And This situation is definitely going to have an effect. There is no way they can be untouched by it. A very simple example is a client calling me yesterday and saying they had an appointment for next week. They look on that appointment as their overall treatment. By them not coming for their appointment because of the fear, they are already getting more anxious. It resulted in a situation where the person had to be referred back to their psychiatrist for a dose adjustment or a review. So the effect is there already. You can imagine going forward, as we've not hit the end of this, how that is really going to hurt. And then the effect post COVID-19. How many new cases we will have of people with mental health issues.